everyone, welcome back to my YouTube video channel again. Today I have a case that 25 years old came with this smile, nice smile, right? But if you look carefully, you can see calculus around the gum. But if you look at the x-ray, you're going to see the bone loss. So sometimes teeth look like this doesn't mean that it's healthy. It's require a lot of scaling. You see calculus under the gum, bone loss. Very young age, but you can see the aggressiveness of the bone loss there, guys. So when you are young, doesn't mean that you are healthy. If you don't see a dentist for a long time, more than 5 years, for example, and if you have vulnerability of the immune system that is not able to fight for bacteria, your bone will lose and you have become gum disease patient. And this is a patient really young but have bone loss, almost 30% of his original bone. And this is the sign that he probably need the gum surgery later on after the deep cleaning. Otherwise, there might be a chronic bone loss and eventually develop isolate tooth loss and eventually generalized tooth loss. And so this is the risk that you have to investigate whether the patient have lack of oral hygiene, then combined with poor diet and lack of exercise or diabetes risk and all of that. So what the solution? We will do deep cleaning. As you can see, the deep cleaning, the purpose is to remove those underneath the calculus that you can't see, but you see it on the x-ray. You can do instrumentation scaling also to after you do the caviton, which is the water pressure instrument where it go underneath and shoot the water, break the calculus, the tartar, and remove the host of the bacteria, where the bacteria host the party underneath those gum and kind of basically trying to destroy a patient dentition periodontal foundation down there. Basically, the gum foundation is held up by alveolar bone, which is the bone surround the tooth, and also the gum attachment. All of these are being replaced by the amount of chemical inflammation, irritation of the gum. Chronic toxicity come from the bacteria that release down and destroy the bone. So having the deep cleaning, like what I'm doing, is really to remove, break down those house calculus accumulation for bacteria housing underneath every tooth. And then we go back and do hand scaler to inspect again all those irregular bone or irregular calculus that's still left behind. Break everything up. And the purpose of the first time deep cleaning is to remove as much as possible calculus. Having a patient come back a few months later, follow up and do again the periodontal maintenance and using the perio probe and measure the pocket. If any pockets still remain in the like more than 5 millimeter with the bleeding, we need to have surgery done. Flap it out, open it up, clean again, and sometimes the needs to have some bone reduction as well. So again, this is the scaler. We have to go back and check and see if there is any tartar left behind. As you can see, after deep cleaning, a lot of bleeding. Thank you for watching, and if you have any concern, question, go see your dentist. Check it out, and the dentist will explain more detail. This is just quick video to demo to you guys that a healthy 25, 26 years old with a nice smile like that doesn't mean that he doesn't have gum disease. It's the only time for you to determine whether you have a gum disease or not is you have to see a dentist, a hygienist. The dentist take x-ray, do a measurement for your gum, and then he can let you know whether you are free from periodontal disease, which is gum disease, and the risk of the gum disease is that you can have multiple other systemic disease like diabetes, heart attack, and stroke, Alzheimer, arthritis. All of these can relate it to one of the kind of prominent bacteria that cause this gum disease is the P. gingivalis. So it's a combination of the overall health situation, not just your gum. So guys, visit your dentist, and the dentist, please, check the gum for the patient and help the patient understand the whole concept of body and mouth connection and systemic disease and bacteria. Thank you for watching, and I hope you subscribe to my channel for more information about dentistry and the latest news. Bye bye.